This is our last week of our pregnancy video series, and this week we're wrapping up with birth prep. So birth prep in our office will usually begin between 34 and 36 weeks. This depends on each patient. If we see a mom who's pregnant with twins, we tend to move that a little bit earlier to make sure that we have time to cover all the necessities. If you're pregnant with a single baby, that'll usually begin closer to that 36-week mark. Relaxation is a top priority for us to cover during birth prep. Our ability to relax all muscles, not just the pelvic floor, can hugely impact labor and birth. And a lot of us will unknowingly tense a lot of muscles. So we'll help patients identify any areas where they might be holding more tension, whether that's the pelvic floor, the abdominal wall, shoulders, jaw. Those are a few of the main points that we'll touch on with these patients. After muscle relaxation, the next key component of birth prep is breath, and specifically linking that to pelvic floor elongation. Our breathing can be the best tool for helping us to relax well, and especially with vaginal births, we need the pelvic floor to be able to lengthen and elongate and get out of the way to make room for baby to be born. We'll often cue this breathing and elongation in a variety of exercises, and I think this is one of the most important things for women to practice, especially if they're looking to have a vaginal birth with minimal pelvic floor or vaginal tearing. We'll recommend an internal vaginal visit around 36 weeks. At this visit, which isn't necessary but can be very helpful, we can assess the pelvic floor for trigger points or knots in the muscles that don't want to lengthen as much as they should. So if we can address and release some of these tighter spots in the pelvic floor, it can really make that elongation with the breathing much, much easier. If a patient is struggling to feel that connection and lengthening with their pelvic floor when they breathe, often this internal assessment and release can be very, very helpful for these patients. The last component of birth prep in our office is some postpartum tips, and these are specific to what kind of birth you intend, whether that's vaginal or C-section. We'll always touch on some at-home exercises that moms can work on in their first 2 to 3 weeks postpartum before we see them back in the office. This is generally just breathing, but because of all the changes that happen in pregnancy, it's always, I think, worth addressing again to help moms feel really confident in having that foundation to be able to apply it at home when they're with their new baby. Some moms come in knowing that they're going to have a C-section. So for these moms, we'll work on some scar-specific gentle mobilization and breathing techniques. So again, they can get a good head start at home before we see them back in the office postpartum. If you're pregnant and local to the Omaha area and either have a problem that you would like help with or just want to get the best head start possible for your pregnancy, birth, and postpartum, please contact our office and we'd be happy to help.